I'm an Italian surgeon working for ICRC since 1997. I would like that the people visiting this exposition think a little bit about the situation and try to understand what is behind the pictures, what is behind the people they are taking in the picture, and then you can see they are not smiling. They are really suffering and concerned about themselves and the people they are supposed to take care. There are a lot of pictures that remind me my previous missions on the field. Afghanistan, Iraq, Democratic Republic of Congo, Somalia, and among the pictures I can even recognize the surgeon sit there. A lot of patients that told us that they arrived maybe days after the needs because there was a checkpoint they didn't allow them to pass, simply because the soldiers there didn't want them to pass. And then they arrive in the hospital sometimes too late to be saved. Peritonitis, cesarean section, not only weapon wounded, but also common pathologies, I would say. People are obliged in a way to stay in a place where they have no future, just hope that the situation will improve, but after 20 years, how can you think that the situation will improve quickly? And they are really committed, they are serious workers. 100 years ago, there was two armies that confronted themselves on the field. The battle could be in one day, and then that's end. And this was the beginning of ICRC history. Now the wars have completely changed, are unbalanced. There is always one army that is much more stronger than the other army, and so there is a kind of guerrilla, etc., and civilians are more and more involved and suffering for the conflicts. Conflict become more and more chronic, longer, and the civilians have more and more problems to have their rights to be treated. They don't have any longer access to basic drugs. They don't have access to basic health services like vaccination for children, for example, dressing, insulin for diabetic patients. These also are new challenges for us. And my first mission as a surgeon for ICRC was in Afghanistan, in the south of Afghanistan. And I remember children brought to the hospital in very, very serious general conditions after a mine explosion, and children that had the same age of my son that lost their life on the operational theater when I was there. I was not able to save them. Could be my child if I was born in another country, in another moment.